Yep, good to go.
All right, so now we're going to do the great vessels, so blood vessels basically. So we're going to start back to the model of the heart we just got done talking about. So we said that this is the aorta, so this is going to be your aorta, and this part that comes up and around is going to be the aortic arch. So basically you have your ascending aorta, this little part, the aortic arch, and then in the back it starts going down, that's going to be the descending aorta. So on other models, what does it look like? Torso. Again, aorta is here, the aortic arch is going to be this part, and in the back, actually you can't really see it because it's behind the organs, but if we get the organs out of the way, actually if we pull the heart right off too, you can see the descending aorta coming down, and then once it gets past the diaphragm, we call it the abdominal aorta, but still descending or aorta down here. Heart back in. On this guy, so again, aorta's here, coming up, the aortic arch is going to be right there, and then again, it goes behind the heart. You can see the descending aorta or abdominal aorta coming down here, and then it splits, and once it splits, it gets a different name. Think about it like a tree. The trunk of the tree, then you have branches. Each branch has a name. Over here, again, aorta, aortic arch coming around, and then again you can see the descending aorta coming down here. And then this guy, he's missing his heart, but this is going to be your descending aorta or abdominal aorta coming down here, again, until it splits, then it gets a different name. That's number one. Next one, back to the heart. Pulmonary trunk. So the pulmonary trunk, remember, is the blue guy. So the pulmonary trunk is here. As soon as he splits, he gets different names. He has one coming off this direction, and on the back side, he has one coming off in this direction. These are going to be your pulmonary arteries. You're probably thinking, Kelly, what are you talking about? Arteries are supposed to be red. No, no, no. Arteries are red because they have oxygen. These ones are arteries because they leave the heart, okay? So arteries are blood vessels where the blood actually leaves the heart. Anything that leaves the heart is going to be an artery. So as the blood gets pumped through the pulmonary trunk, it enters pulmonary arteries. The pulmonary arteries go to the lungs. So if we look on this guy, pulmonary trunk is here. The heart contracts, the blood goes through the pulmonary trunk, it splits and goes into the left pulmonary artery, and it goes into the right pulmonary artery, where it goes and picks up oxygen and returns back to the heart in a vein. On the torso, pulmonary trunk, pulmonary artery going this way, pulmonary artery going this way. Okay, pulmonary arteries. This guy, pulmonary trunk, pulmonary artery, pulmonary artery. This guy, no arteries. Okay, so now, moving on. So now we're gonna look actually at the branches that come off the aorta. So remember, we're back to the aorta here, and it has three branches. 1, 2, 3. The first one is going to be your brachiocephalic artery. So brachiocephalic artery is the first one. The second one is going to be your left common carotid. And then the last one is going to be your left subclavian. So it goes brachiocephalic, left common carotid, left subclavian. So those are the three little nubs. So now if we look at a model like this, aorta. First branch is right here, so you can see the little branch right there, brachiocephalic, which comes up and as soon as it splits, gets a different name. For now, brachiocephalic is there. Left common carotid comes up, again it splits, different names. And then the last little branch is right here, left subclavian comes up, goes under the clavicle, and it gets a different name. All right, so that's the next one. This guy, so again, you can still see the aorta. You can't really see the brachiocephalic because it's kind of covered. Maybe it's this one, but I wouldn't label it on here. But maybe this one's your brachiocephalic. That one right there, that little nub, might be your left common carotid coming up. And then this one over here that comes up and under, it's going to be your left subclavian there. So that guy doesn't have it. And this one, aortic arch, brachiocephalic's here. Left common carotid is going to be this one that comes up here. And then left subclavian is going to be the one that comes up and wraps over here. Next one down, the right common carotid artery. So let's go. We can't go any further on the heart because it doesn't go any further. So we are out for this for now. Let's go to this guy. So our aorta, our aortic arch, our brachiocephalic artery comes up, it splits. I told you, it's different names when it splits. The branch that goes this way is going to be your right subclavian artery, whereas the branch that goes up towards your head, just like you have over here, the left common carotid, this is going to be your right common carotid. Remember, this is his right side, this is his left side. So right common carotid artery is here. Can't see it in that guy over here. Aorta, aortic arch, brachiocephalic artery comes up, right common carotid artery goes up. This is your left common carotid artery here. Then the right subclavian comes down this way under the clavicle. And in this guy, can't see it, so I'm not going to bother. But you can see a little piece here of the left common carotid artery coming up before it goes into the head, pretty much. So we're pretty much done with this guy, and we're done with that guy. So we're going to be down to just these two models, which is great. All right, so our carotids. We said we have a left common carotid artery here and here. When they come up, they split. So let's just look at this one first. So our left common carotid artery comes up. You can see it splits right here. One branch stays on the outside of the skull. That's going to be your external carotid artery. So external carotid artery. All right, that's going to be, I'm just making sure it's on your actual on the list. Yep. And then the one here, the branch you can see right here where it goes in, see it right there, that little tiny branch that goes in, that's going to be your internal carotid artery that goes inside the skull and feeds the brain. Alrighty, we already did the subclavians. Vertebral artery, so not the left common carotid, but over here, you have a little artery right there. That's going to be your vertebral artery on the left side. So that's your left vertebral. You also have one on the right side, right vertebral here. This guy, again, this is going to be your your left common carotid artery coming up. The one that stays on the outside of the skull is going to be your external carotid artery, and the one that goes in and feeds the brain is going to be the internal carotid artery. This one right here is going to be your vertebral artery, right there, and over here is going to be the one that's on the other side, basically, right vertebral and left vertebral. All right, going back to the heart. So we've done arteries, now we need to do some veins. So remember, this is the pulmonary trunk, this is your aorta here. So what are these guys? There's one here, and if we actually take the heart off the stand, there's another guy here. This is going to be your superior vena cava coming up. This is going to be your inferior vena cava on the bottom. So if we look at one of the flat models now, put this heart back on here. Heart, pulmonary trunk, aorta, superior vena cava, it's above the heart. Inferior vena cava gets all the blood from below the heart, basically. Anything from your arms down. Over here, superior vena cava is above, inferior vena cava below. This guy, superior vena cava up here, inferior vena cava you really can't see because it's kind of behind all the guts, and you can't see it back there either. So just you can see superior on this one. Okay, now the azygos and the hemiazygos. So the only one that has both of them is going to be this guy. So your azygos is going to be this one that comes right down that runs along the actual spinal cord, and then the one that goes off to the left over here is going to be the hemiazygos, because this is going to be hemiazygos over here. So this is the only one that has your azygos and your hemiazygos on it. All right, moving along. Jugular veins, so external versus internal jugulars. It's the same story as the carotids, but now we're talking about veins. So coming off of your outside of your head, this blue one now, not the red one, is going to be the external jugular vein, whereas the one that went up into the skull is going to be the internal jugular vein. They join together just to form the common jugular vein here. I think they still call it external, even though it should be common. Here, same story over here. So external jugular, it's going to be out here. Internal jugular is the one that goes in and feeds, comes down. And then over here, I think the only one you can see a little piece of is going to be your external jugular right here. So, and then I think there's a little tiny chunk of internal jugular going into the head. Okay, I don't worry about that. All right, brachiocephalics. So now if we go back to the lovely little heart, we said this is our superior vena cava coming up. So superior vena cava has a branch, this little tiny chunk right here, and this chunk that goes all the way over before it splits. So this little piece here, and this little tiny region before the splits, this little tiny chunk, are going to be the left brachiocephalic vein and the right brachiocephalic vein. Once it splits, it gets different names, and then it turns into your jugular, and it turns into your right subclavian vein, and again over here it's going to be a jugular, and then it's going to be the left subclavian vein. So these little two regions are going to be brachiocephalics. The only place you can see it is going to be on this guy. So remember, superior vena cava. This little chunk here is going to be your right brachiocephalic. This chunk right here is going to be the left brachiocephalic. It turns into a jugular, and then a subclavian. Over here, again, a jugular and a subclavian. And that is it, blood vessels. This is for lab exam number 2. So we're doing peripheral vessels, nerves, and lymphatics. So we're going to do the vessels first. So we're going to start with arteries. So just to review from before, remember this is from the practical number 1, the aorta with the branches coming off, brachiocephalic, left common carotid, left subclavian. But once you get past the subclavian, so this is your left subclavian, this is your right subclavian. Once you get into the armpit area, so look for the bones, this is called an axillary artery here. So this would be your left axillary artery here. Your right axillary artery would be over here. They turn into, once you get down to where the actual humerus is, the brachial artery. So it's going to be, so it just turns from axillary artery into brachial artery. And as you move down into the forearm, once you get to where the radius and the ulna are, I don't use this side because the bones are flip-flopped. This side is the side that I use. So we go from axillary arteries to brachial arteries, and then splits. Look for the thumb and for the pinky. Remember, if it goes to the thumb side, remember this is thumb side, this is going to be your radial artery here, and if it's on pinky side, it's going to be your ulnar artery here. All right, sounds good. So now we're going to move to veins, still in the same area. So remember, this is your superior vena cava here, your little brachiocephalic vein here and here. You had your jugulars here and here, and then you had your right subclavian and your left subclavian coming out this side. The subclavians, once you get into the armpit, again, this is called an axillary vein here, and once it branches into a basilic vein. So the basilic vein is this one here, and this one that just kind of magically stops, actually does not magically stop, but it keeps going. This is your brachial. So brachial vein would come off of this little guy and continue. This would be the basilic coming down on this side. Once you get here to where the inside of your elbow is, when you get your blood drawn, this little V area is going to be your median cubital vein, so it's where you get your blood draw from. And again, think about the bones. So if it's going to be on this side, it's going to be the radial vein, and if it's on this side, it's going to be the ulnar vein. So those are your veins and arteries for the top. Now for the bottom. So we have our descending or abdominal aorta coming down. This first section where it splits into a right and left is going to be your common iliac artery. So we're talking about the red one. When it splits, the branch that goes inside is going to be your internal iliac artery, whereas the bigger branch that keeps going down the leg is going to be your external iliac artery. So this external iliac arteries, again, this would keep going. It wouldn't just magically stop. Over here, it does keep going. So once you get past the pelvis, we call it the femoral arteries. This would be your femoral artery coming down. Once you get to the back of the knee, you guys know this is the popliteal region. This is a popliteal artery. Some people label it here. Some professors will label it as this wadded up mass of blood vessels over here. So think knee, think popliteal. Now I use this leg because if you look at the bottom of the leg, the foot is kicked sideways. So you can actually see the anterior side of the leg versus the posterior side of the leg. This one you kind of see the foot's looking straight at you, so you'd only see the anterior side. You can't really see posterior too well. So this would be anterior tibial artery over here, anterior tibial artery. So that's one. Whereas the one that's in the back would be the posterior tibial artery, which I guess maybe they could label this one as posterior tibial artery. I'm not sure. Again, you probably have to ask about that one. As far as veins go, you only need to know apparently 2 on the lower leg, the small saphenous and the great saphenous. The small saphenous is this little guy over here, so he's closer to the fibula, whereas the great saphenous is the much larger one that runs along the inside of the leg and goes all the way up. So great saphenous is here. And just remember, this is the exact same thing. It's just a different color background basically, so as long as you can find it there, you can find it here. Common iliacs, internal iliacs, external iliacs, femoral artery coming down, popliteal artery here, posterior tibial artery here, anterior tibial artery is going to be here, small saphenous vein here, large great saphenous vein here. Up in the arms, just remember, superior vena cava coming off the lovely subclavian, you have the axillary vein, you have the brachial vein coming off here, the basilic vein coming down here, the median cubital vein is here, you have your your ulnar vein is here, your radial vein is here, your radial artery is here, your ulnar artery is there, the brachial artery is here. Once you get to the armpit, it's called an axillary artery up here, feeds into the subclavians. I think that's all of it. So, all right. So now all we need is nerves, and the nerves are on a different model. All right. So this is going to be the nerves. This is going to be the nerves of the upper extremity, so the upper arm. So the median nerve, median, think middle. It's really easy. So it's going to be this nerve right down here that goes straight down the middle of the arm. So median nerve is here. Musculocutaneous is going to be, when I label it for a practical, I usually label it as these ones that kind of wrap around in the muscles and the skin. I'm not really sure if they have it labeled on here as musculocutaneous. The label is number 21, wherever Mr. number 21 is, right there. So it's this little guy, according to the chart. If we want to be super accurate, it's going to be this guy right here. I label it usually this one, but I guess it's this one too. So musculocutaneous, median comes down here. Your radial nerve is going to be this one right here on the outside. Remember, because it's on the thumb side, whereas the ulnar nerve is going to be this one on the inside. That's it for arms, nerves of the upper arm. In the leg, the biggest one, which is going to be this deep one, not the one that comes on the top of the pelvis, but the one that actually goes through your obturator foramen, which you guys should know where that is, around the back of the pelvis basically. It's going to be your sciatic, so your sciatic is going to be here and here, coming down. Once you get down towards the knee, it turns into the tibial nerve, so this can be the tibial nerve here. Now we're having a little bit of a debate if you're going to call this just tibial here, or if we're also going to call it tibial here. I'm not sure how you're going to label it for practical. You're going to want to ask. The tibial nerve comes down. I don't know if they're going to call this posterior tibial or just plain old tibial, but you need to know posterior tibial. This one over here, this branch is going to be the sural nerve, so the one that's in the back of the calf, and then the one that's in the front is going to be your perineal or common fibular nerve up here in the front. So common fibular, you could also see a little chunk of it right there. And that is it for nerves. This anywhere. All right, guys, we're going to do a little bit of lymphatics because it's already right here. So this is your spleen right here, and you have to know the diaphragmatic surface versus the visceral surface. The diaphragmatic surface of the lovely spleen would just be the surface of the spleen that touches the diaphragm. So anything that's touching this diaphragm muscle would be diaphragmatic surface. This side, and like that's touching over here, that's touching a little bit of your kidney, the side that would be touching the stomach would be the visceral surface of the spleen. The hilus is just going to be where everything comes in and out of the spleen. So where these blood vessels are coming in and out would be the hilus of the spleen. The splenic artery going to be the artery that feeds into the spleen. And then the veins just going to be the blue guys that come off of the spleen. And that's it. Just more, ready?
Yeah.
These are just more spleen. So this is going to be your spleen here. Again, remember, diaphragmatic surface touches the diaphragm. This side that's touching your kidneys is going to be the visceral surface. The red one going into it's going to be the splenic artery. The blue one coming back out is going to be the splenic vein. And where everything enters and exits the spleen is the hilum. Good. Over here, same story. This is the spleen. The surface touching the diaphragm, diaphragmatic. The surface touching the other organs is visceral. Red is splenic artery, blue is splenic vein, and where everything's coming in and out of the spleen, hilum. Okay, so a couple of things, we're still going to be in lymphatics, guys, but a couple of things I'm going to mention before you start looking on models, they're just not there. So there's no thymus on the models. There's also no lymphatic vessels on the models. So this whole section is going to be either in the textbook or probably again in the textbook. So if it's on a practical, it's going to have to be an image of these things. So like your thoracic ducts, your cisterna chylis, all those things are going to be in images. Apparently page 753 if this is the current version of the textbook, but who knows? All right, so we're going to move on to lymph nodes. So lymph nodes, a torso is probably going to be the only place you can see it, and a couple of them you're not going to be able to see at all. So the cervical lymph nodes would obviously be in the cervical part of your body, which is the neck. But the ones you can see on the model, if you look in the armpit, these are called axillary lymph nodes, these little pinkish, beigeish, whatever colored blobs. So these are going to be axillary. Remember, axillary means kind of armpit area. So axillary lymph nodes are going to be here. The other ones are called inguinal. They're going to be in your groin area. So the inguinal lymph nodes are going to be down here. And then we do not have a model, but if you went further down, there's going to be popliteal lymph nodes. Obviously, popliteal means the back of the knee. So you'd find them at the back of the knee. So that's it for lymph nodes. Now we're going to move into the respiratory system. Ready? Now, so we're going to start with some upper respiratory structures. So things we can see on a torso to begin with. The external nares is a fancy name for the nostril. So the nostril is the external nares. The nasal septum is the divider that would separate. Remember, there's another side of the face over here. So your nasal septum separates your external nares. So it's going to be your septum in your nose. If you look inside of the actual nasal, this would be the nasal cavity, this whole area here. This first region, if you stick your finger up your nose and you start touching where those little nose hairs are, is called the vestibule. After that, you're going to have a couple of bones here, which are going to be your nasal concha. You have a superior, middle, and inferior nasal concha. They kind of make the air swirl around inside your nasal cavity. You can also call them nasal turbinates, so inferior, middle, and superior nasal turbinates. Behind them, the region where your nasal cavity starts to narrow, where my finger is, would be the internal nares. It's the last section of the nasal cavity before you start entering the structure called the pharynx, which is going to be at the back. We'll look at a different model for the pharynx. Other things you can see on this model, the nasal bones. Remember, the nasal bones would be the part that makes the upper part of the bridge of your nose. You can see the maxilla. The maxilla, remember, is the upper jaw, so the upper jaw is your maxilla. The palatine bones are going to be in here, right? Remember, we had a palatine bone in the back, and also some of it was the palatine process of the maxilla that made the roof of your mouth, that made the palate. This palatine bone, the palatine process of the maxilla together form the hard palate. So if you put your tongue in the roof of your mouth, the hard part that you press on is going to be your hard palate. If you go more posterior to that, where it starts to get soft and squishy, it's called the soft palate. And at the very, very back, you're going to have a little dangly ball called the uvula, but we'll see that in a different model too. Other than that, up here you can see the frontal sinus. So you can see there's just like a space in the skull, the light in your skull called the frontal sinus here. You can't. And then back here, I guess they'd label this as the sphenoidal sinus, but there's a different model that's a little bit nicer to see. So now we're going to move away from this guy, and we're going to move actually to this guy. So this is going to be your flat sagittal view of the head, starting from the beginning again. External nares is going to be the nostril, so there actually is a nostril on this model right here. Nostril, external nares. The nasal septum, again, dividing the two external nares from each other. When you stick your finger up your nose, that little region right here is the vestibule still. This whole structure would be the nasal cavity, and inside the nasal cavity, you have nasal concha or nasal turbinates, an inferior nasal turbinate, middle nasal turbinate, superior middle or nasal turbinate, or you can call it concha. I call them concha. At the back, where it starts to narrow, is going to be your internal nares, so it's that region right here. After the internal nares, we move into a structure called the pharynx. So the pharynx has three parts. It basically extends from right about here, using the palate kind of as a border, all the way down until you get to the hyoid bone. So the hyoid bone, you can see, is about right here. So this whole structure of tubing from here to here is going to be called your pharynx. So this whole part right along here. The first chunk of the pharynx, this region here, until you get basically to the bottom of your uvula, is going to be the nasopharynx. So this is the nasopharynx because it's behind the nasal cavity. So nasopharynx, nasal cavity. The region here between basically where this is your little uvula hanging down, and the top of your epiglottis aka where your hyoid bone is going to be the oropharynx here. And then below that, this structure here is called the larynx. So this little section of pharynx can be the laryngopharynx. So nasopharynx behind the nasal cavity, oropharynx behind the oral cavity, and laryngopharynx behind the larynx. Inside of the structure, so we go back up here to kind of the back of the nasal cavity, the internal nares / nasopharynx region. You have a pharyngeal tonsil, so it's going to be this little pink blobby right here, pharyngeal tonsil. You also have an opening. Believe it or not, this is a hole, and this little opening would actually connect to the inner part of your ear. This is called the opening for the auditory tube or the eustachian tube. You guys remember that from sense organs. Remember, it connects to the inside of your ear, so you can equalize the pressure across your tympanic membrane. The nasal bone, you can see a little bit of nasal bone right here. Just remember, it's making the bridge of your nose, the top part. You can see some of the maxilla. The maxilla is going to be your upper jaw, where your upper teeth connect to, basically, is your maxilla. The palatine bone is going to be back here. Remember, it kind of butts up to the palatine process of the maxilla, forming the hard palate. Behind the hard palate, you're going to have a squishy part called the soft palate, and then dangling off the soft palate, you're going to have your little uvula here. Frontal sinus is going to be this space here in the frontal bone. Again, it's just to lighten the skull. And then the sphenoidal sinus is going to be here in the sphenoid bone, again, to lighten the skull. That's it for upper respiratory structures. Long leg wires or skull. Alright, so a couple of bones, in case they don't throw a skull in there to throw you off, I want to make sure you guys see it on the skull too. So remember, the nasal bones are just these bones here that make up the bridge of your nose. The maxilla is just the upper jaw here, this one here. If we flip the skull over and look on the other side, the palatine bones are here and here. They build up to the palatine process of the maxilla, so these little palatine bones are these guys. Remember, this is going to be your hard palate. Behind here, extending, would be the soft palate. Other than that, you can't see anything else in the skull, but I just wanted to show you on this, just in case. Alright, so now we're moving into the lower respiratory system structure. So you can see a couple of them on this model before we actually move into the larynx model, so I'm going to show you here first. So first of all, if we're coming down, we talked about the pharynx here. This is the last part of the pharynx. This is the end of your upper respiratory system, the laryngopharynx. Once you get to the larynx, which is this structure here, you're now going to be in lower respiratory system. A couple of random things that aren't part of the lower respiratory system but are on the list. The esophagus. So the tube behind your larynx is going to be your esophagus back here. So this is your esophagus here. This actual structure is a side view of the larynx. This little blue piece here actually coming up is actually a flap that goes up and down, and it's called the epiglottis. So it's going to close off your airway when you eat and drink so that food doesn't go into your lungs. So this is your epiglottis here. The parts of the larynx you need to know, this is thyroid cartilage. So most of the larynx is made of thyroid cartilage, this upper blue piece. You also have a little bit of cricoid cartilage down here. We're going to see this from a different view, and it's going to make a lot more sense in just a minute. Other than that, I don't think you can see anything else. You can't really see the trachea on here. You can see a little bit of the hyoid bone. So the hyoid bone is this little kind of cross-sectional view right here where all the ligaments and muscles are attaching. Hyoid bone is going to be right there. And then the vocal folds are going to be, basically vocal folds and vestibular folds are going to be these guys right here. That's it for this one. So now we're going to move to a different model. Ready?
Yep.
Alright, so on this little model, there's a couple of things we need to see too. So if we just flip it around, this flap that's sticking up is going to be your epiglottis. So you can see your epiglottis here. Remember, this entire structure, basically, this is your hyoid bone. This is just some ligaments that attach your hyoid bone to your larynx. So this whole thing is going to be your larynx here. So it's going to have a bunch of parts. The epiglottis is one part. So the epiglottis is this flappy fold that actually comes up and down in the back. In the front or the side view, so this is going to be your thyroid cartilage. Thyroid cartilage makes up, if you look underneath, makes up the majority of the larynx, so it wraps all the way around. Below that is going to be cricoid cartilage. You can see it here, and it wraps, again, all the way around. Other than that, I don't think they would ask you any of those. So the other thing is, once we get past the larynx, we get into this tube here that has all these rings. This is clearly your trachea, and these little rings are tracheal cartilage rings, so they wrap around like this. Again, we said the hyoid bone, which is going to be up here. Hyoid bone, and that's it for this model. Right, ready? This is the nicest model of the larynx we have, but we will use the crappy one too, just in case they show you that. So starting at the top, this is going to be your hyoid bone here. As we move down, if we actually look, this is all larynx, so this big piece of cartilage and this piece, so from here to here is all going to be the larynx. The large piece of cartilage, this big one that wraps all the way around, is going to be the thyroid cartilage. The lower one that's here that has some muscles attached to it is going to be the cricoid cartilage. If we turn it around, the flappy flap is going to be your epiglottis, again, like we said before. These pieces here and here are going to be what we call arytenoid cartilage. Again, down here, if you look in the trachea, you have your rings of tracheal cartilage, so tracheal cartilage is going to be here. On this model, I'm not sure how your teacher's going to ask you, so you might want to double check. When I label it, you can either label corniculate cartilage as these little pointy pieces here, so basically after the little blue line forward, or alternatively you can label it as the pieces, that are here and here that connect to your vestibular folds. So it can either be this horn, or it can be this horn and this horn. So just make sure you ask. And then the other piece of cartilage you need to know is going to be the cuneiforms, and the cuneiforms are going to be this bump here that sticks up. So this little bump on this side, not the same as this one. So this one over here and this one over here, cuneiforms. Other than that, you have your outer vestibular folds. So I guess they're labeled number 7. I think maybe it's a 7. I'm not really sure. And if you open it up, that lighter, slightly lighter yellow pink on the inside is going to be your vocal folds. So those are your folds. And that's it for this model.
Sure, for the crappy model.
So now this model has had a better day. So I'm going to show you what I can on it, but a lot of it is just kind of beyond me even. So this is going to be a little piece of hyoid bone here. This is going to be your thyroid cartilage here, and then your corniculate cartilage is here. The trachea with the tracheal cartilage is going to be here. So from the inside view, now if we look on the inside, this has like the thyroid and everything on it. Look on the inside, we can see a couple of things. We have an epiglottis, which is going to be this gray thing sticking up, because these two pieces would actually go together. So these are going to be epiglottis coming up. Vestibular folds are going to be here and here. Vocal folds are going to be down here and down here. Other than that, I don't really think you can ask anything else on this beauty. So I think that's it. So we're going to talk about trachea first.
Okay. This is a very flattering angle.
Okay. Ready?
Yeah.
All right, so here we go. So just repeat myself a little bit. You still can see the hyoid bone on top. You still can see the larynx here. So this is still going to be your thyroid cartilage. It's still going to be your cricoid cartilage. And if we open it up from the back, still have an epiglottis here. Still have a vestibular fold here, vocal fold here. And I think that's about all I can ask you on this one too. So we just put it back, reattach it to the lovely rest of the model. Trachea is coming down. The blue rings are going to be tracheal cartilage, and if they label it as trachealis muscle, it's usually the lighter colored blue that's in between, so it's going to be trachealis muscle. It's really the only way you can label it on these. As you come down your trachea, right when it splits, you have this fun-shaped piece of cartilage. It's not a ring, it's more like a little, kind of like a diaper at the end. It's called the carina, so it's going to be your carina here. And once you get past where it's a single tube called the trachea, once it splits, it gets a different name. So think about it like a tree. The trunk of the tree is called the trachea, and once it splits, each branch gets a name. This first branch is called the primary bronchus, and then when it splits again, it turns into secondary bronchus. So secondary bronchus, or secondary bronchi for multiple. So just remember, trachea, primary bronchus, primary bronchi. When it splits, secondary bronchus, secondary bronchi, whatever, however you pronounce it. Okay. So that's it for the lovely tubing. So now the air's come all the way down. It's come down into the secondary bronchi, goes into tertiaries, quaternaries, all the way down. So teeny, tiny ones. Now we actually get into the lung tissue itself. So we're gonna put the lungs back on. Actually, can you grab me that heart? I'm just gonna shove it in there just for 1 second, just for one thing. So we're gonna stick the heart back in, even though it's kind of blocking the trachea. But I guess you guys don't really need to see that anymore anyway. Put this back. Okay. So now we're ready to do some lungs. So, in general, the lungs have 2 regions. They have a pointy top part, which you can see, hang on, shift it a little bit. Pointy top part up here. This is called the apex of the lungs. And then if we move to the other side of the lungs, the lower end down here, this flatter side is going to be the base. So, the apex is the pointy top, base is the flatter bottom. Sounds good? Where everything comes in and out of a lung, so if I actually just open this up so you can see the regions again. You can see there's a little part in the lung right here where the bronchi enters, also blood vessels enter. You can see the arteries and the veins going in and out here. This little region of the lung is called the hilus, or the hilum. It's where everything basically enters and exits the lung. So this is going to be your hilus here. If we put everything back, which we just dismantled. And this one would be like so. Sort of. Get in your home. Okay. Remember, this is the right side for this person, this is the left side. It's always in relation to the person, not to you. So this is going to be your right lung, this is going to be your left lung. In your left lung, you have a big divot in the lung. This is called the cardiac notch. Cardiac, because cardiac means heart, right? So the heart doesn't sit dead center in your chest, it sits slightly off to the left, so you're going to have a cardiac notch in your left lung here. You're also going to have some fissures. You guys know about fissures because you remember them from back in the day when we did the brain. You might want to back up quite a bit. You're a little bit short. So fissures are going to be cracks in the lungs. So we basically have, on the left side, you only have one fissure. So you can see it here, this big crack. It's called an oblique fissure. So it divides your left lung into a superior lobe and an inferior lobe. Whereas on the right side, we have a crack going straight across here. And we also have one going up and down over here. So there's two. Don't worry about the one where the model actually comes apart. That one doesn't count. This is one, and then over here you have one. So you still have your oblique fissure here, but now you have one called a horizontal fissure because it goes horizontal across the body. And what this horizontal one does is separates your superior lobe from your middle lobe, and the oblique one separates your middle lobe from your inferior lobe. So just remember, on the right side you have 3 lobes, left side you have 2 lobes. All right. Last but not least, if we open it back up so we can see arteries and veins. Opening, closing, get the heart out of the way. Arteries and veins. Now you guys are probably thinking, well, of course the artery is red, and of course the vein is blue, and of course you would be wrong. So don't do that. When we're talking about pulmonary arteries and veins, they're just the opposite. So I want you guys to think about where the blood is going. So when the heart pumps, it leaves via a pulmonary artery. So that as the blood is leaving, any blood that leaves the heart is going out an artery always. So when the heart contracts, it pumps the blood out these pulmonary arteries. They're blue because they don't have any oxygen in them yet, because we haven't gone to the lungs to pick it up. So this is a pulmonary artery in blue, okay? Once we get into the lung, we pick up the oxygen. That's when the the blood vessel turns red. So this is actually going to be a pulmonary vein, even though it's red. So just remember, it's just the opposite of what it is in every single other model of the human body. Pulmonary arteries are blue, pulmonary veins are red. That's it for the lungs. And I forgot one more thing. So the only other thing on this entire list for lower respiratory system is going to be this sheet of muscle here, the diaphragm. So when the diaphragm contracts, it pulls the rib, basically it makes the inside of your thoracic cavity get bigger, pulls air into the lungs. So diaphragm. That's it. All right, so we're going to do the digestive system part 1, the oral cavity first. We're going to start off with the gingivae. The gingivae are just going to be the fancy name for your gums. So gums are gingivae. The tongue, obviously, I think that's pretty obvious for everybody. The tongue is here. At the base of your tongue, though, back here is going to be the lingual tonsil. Lingual, think tongue. Think language, think tongue. So lingual tonsil is here. Believe it or not, this little bump here it has a number on it. I think it's whatever number that is. I can't even read it. K, maybe it's a letter. K. That's going to be your palatine tonsil there. This is your oral pharynx, just to remind you. Remember the epiglottis, which is part of your respiratory system, but obviously it's still on this list, so it's your epiglottis here. All right, the only other thing I wanted to mention is if they show you it on this model, obviously you can't see the gingivae because there's no gums on here, but you can see the tongue here. You can see the lingual tonsil, which is this big blob back here. So basically use your circumvallate papillae as the border. If it's behind there, it's going to be the lingual tonsil here. The oral pharynx, you can't really see it. Remember, this is going to be your epiglottis. So that's all I wanted to show you on these two. Now we're going to move to teeth. This one you're going to have to be up pretty high, so you need to be able to see all 3 of these, if you can. If not, just focus on this one for now, and then I'll tell you what I need to move. All right, so now we're going to do the teeth. So the teeth have a whole bunch of parts. Oh, teeth have a whole bunch of parts. The crown is going to be this outer part, so it's going to be like kind of the white part that you see. So it's going to be the part that's above the surface of the lovely gums. So this is going to be the crown up here. The next part down is going to be this little region here, basically where it's connecting. So where the tongue or the tooth actually connects to the gum line is going to be the neck. So the part you see is a crown. The next region down is going to be the neck, and then everything else that's that's lower than that looks like a root is called the root. So just remember, the crown is the top part you see, the neck's kind of like the intermediate version, and then anything you don't see that actually holds the tooth in place is going to be called the root of the tooth. At the bottom, you have a little part where the blood vessels and nerves enter and exit. That's going to be the root canal, so you can see the root canal coming up in here. So this is your root canal here. The apical foramen is the little tiny hole at the base of the root where the actual blood vessels and nerves enter and exit, so that little tiny hole there. Enamel. Enamel is this white covering that's around the outside of the tooth. It covers the entire crown. It also kind of goes down into the neck itself. So you have enamel there. Dentin is going to be the next layer down, so this yellow colored stuff is going to be your dentin. So you can see the dentin, it kind of wraps all the way down, goes down into the lower parts of the tooth as well. The pulp cavity is going to be this area here. So the pulp cavity is the inner part of your tooth. It's got the blood vessels and the nerves in it. Holding your tooth in place, you have a periodontal ligament. So periodontal ligament, I'm assuming they're labeling as number 26. This thing that kind of looks like little dashed lines that actually hold the tooth in place. But also in there, you have some cementum. So the cementum is going to be this inner layer here that is kind of like a glue that helps hold the tooth in place. So it's, I guess they're labeling it number 23. So that's going to be your cementum in there, along with your periodontal ligament, hold the tooth in the socket. Your occlusal surface. So your occlusal surface, you actually need to see 2 teeth, both sides. So the surface of your molars back here, basically, that come in contact with the other part of your jaw, so where your upper jaw and your lower jaw touch each other, especially when you're chewing, those 2 surfaces that rub against each other are going to be your occlusal surfaces here and here. As far as what your teeth are numbered, so you have a whole bunch of numbered teeth in the front, the little tiny baby teeth. There's 4 on the bottom, there's also 4 on the top. These are called incisors. So the first pair, your 2 front buck teeth, are going to be your central incisors. Also on the bottom, the 2 central ones are going to be the central incisors. The next 2 out are going to be the lateral incisors. So you have lateral incisors there, lateral incisors here. So on this one would be the central incisors, followed by the lateral incisors. The next one down is your pointy teeth. Pointy teeth are called the cuspids or the canines. So this is going to be a canine here. Also you have a canine here, you have a canine here, you have a canine here, and you have a canine over here. So just remember the canines are going to be the pointy teeth. Behind them, so moving back, so moving more towards your big molars in the back, the next ones back are going to be your first bicuspids or premolars, so number 4. So again, you can see it right here. First premolar right here, and also first premolar right here. After that, you have your second bicuspids or second premolars, which are going to be here, here, and here. And then after that, you're just going to have plain Jane molars. So you're going to have your first molar, your second molar, and your third molar. So they just go in order. First molar, second molar, third molar. You can see the molars have a lot more roots than your little premolars do that only have a single roots. And that's it for teeth.
Sure.
Alright, so now we're going to go into bone processes and the palatine structures, again still in digestive. So the alveolar processes are just the little sockets that the teeth sit in. So basically if you could take one of these teeth out, which I'm surprised none of them actually come out. Oh, here we go. It's on the bottom. This little socket is going to be, obviously this is the mandible, so this is going to be the alveolar process of the mandible, because you're in the lower jaw. But the exact same thing would be, this would be the alveolar process of the maxilla, because you're in the upper jaw, the maxilla. So just remember, maxilla is upper jaw, mandible's lower jaw. You guys should know that though. If we look in here, the palatine process of the maxilla, remember this whole thing is the maxilla, use the crack as a border. If it's before the crack moving towards the teeth, this is going to be your palatine process of your maxilla, whereas if it's behind the crack, this little fragment of bone here and bone here is the palatine bones themselves. Together they make up the hard palate. Remember, the soft palate would be behind it. So if we look on this guy, hard palate, oh sorry, wrong place. Hard palate, I'm losing my mind. Hard palate's where you have the bone, so this is going to be your hard palate here. As soon as it gets soft and squishy behind the bone, you have a soft palate back here, and then your little dangly ball is going to be your uvula down here. That's it for that one. Now we're moving into salivary glands. This is the only model you have, I think. Ready? Salivary glands. So all we care about is up here. There's only 3. Parotid. Para means next to, and otic means ear. So parotid salivary gland is this big one here. If we look inside from the other direction now, under the tongue, I said think tongue, think lingual. So this is going to be your sublingual salivary gland here. And then if we go back to the outside, there's going to be one hiding up under your mandible. Under the mandible would be submandibular salivary gland there. So parotid, submandibular, sublingual. That's it for this one. So let's look at a different model. So this one, even though we don't have a face on it, believe it or not, we can still see 2 of them. We can see the sublingual salivary gland here under the tongue, and the submandibular salivary gland here hanging out the bottom. And then on this flat one, again, parotid salivary gland near the ear, sublingual underneath the tongue, and submandibular down here. That's it. Alright, so we've already talked about all these structures up top, so we're moving down now. Once we get to here, this is the esophagus coming down clearly. So esophagus is here, and when it ends, right here before it joins the stomach, there's actually a ring of muscles, and it's called the lower esophageal sphincter. So the lower esophageal sphincter is here. The other 2 parts you need to see under the esophagus on your list, you need to see actually on a torso. So the esophageal hiatus, so if we look here at the torso, number A, look here at the torso. This is your esophagus coming down in the yellow, not this white stuff that's wrapped around it, but the actual yellow tube is your esophagus. And you can see it pops through this muscle sheet, which is the diaphragm, and it makes a little hole. And that hole has a name. It's called the esophageal hiatus. So the hole where the diaphragm punctures, or the esophagus punctures the diaphragm, is your esophageal hiatus. Obviously, this is the diaphragm itself. So that's it. And then I wanted to show you on this one too. This is scary. From the other torso, this sits in the other torso. It's in the room that we just didn't drag out. So just so you guys realize, there's the hole the esophagus comes through, right? Comes down in. That's called the esophageal hiatus. It might actually be this hole. Not sure. One of the holes. I'm not sure how it sits over there because I don't ever play with that model. Esophageal hiatus. This is your diaphragm, this creepy looking thing here. So it should be fine. All right, moving into the stomach. Okay, so now we're going to move into the stomach. So we're going to start on the board first. There's a bunch of parts of the stomach you need to know. You can't see the actual layers of muscle on the flat boards. The only one you can see it on is going to be this one. So if we look at this stomach, you can see that there's a couple of layers of muscles. So what are the muscle layers basically? Well, if you look carefully at the model, this is the most superficial layer. The next layer down is this one, and then the deepest layer is going to be this one. So the most superficial one is labeled 401, the middle one is 402, and the deepest one is 403. So which one is which? This deepest one here is going to be what we call the oblique muscle layer. So this is your oblique muscle layer here. The one that wraps around like encircling the stomach is going to be the circular layer here. And then the outermost one is going to be the longitudinal layer that's out here. So it goes longitudinal, circular, oblique. Those are your muscle layers in your stomach wall. Moving along. So now we have some curves. So these are really, really easy. The stomach, as you can see, has a big curve on the outside and then has a smaller curve on the inside. This is called the greater curvature of the stomach. This is the lesser curvature of the stomach. So on this one, same thing. Greater curvature of the stomach, lesser curvature of the stomach. And then the other stomach we have, greater curvature of the stomach, lesser curvature of the stomach. That's good. You have some momentums, which we don't have any models of, so I'm not sure where you'd see those except for on a dissection. So there's a greater omentum, which would hang off of the greater curvature, and there's a lesser omentum, which actually connect the stomach to the liver. So it'd be a little piece of, basically looks like fat. It's like a yellowy tissue that connects these two guys together. What else do we got? So we got some portions. So the first little chunk of your stomach that kind of is near where your esophagus joins is called the cardiac portion of the stomach. So you can see it here. If we open this guy up, if he even opens, cardiac portion would be right around here. And the same thing here, maybe this darker colored pink region would be the cardiac portion of your stomach on this one. After that, we got some other regions. We got a fundus. So the fundus is this upper dome shaped part of the stomach. So basically not the little cardiac region, but just this upper dome part here, the upper dome part right here, and then the upper dome part right here, fundus. The body is going to be the majority of the stomach, so all this region here, basically from the fundus coming all the way down, this whole space is going to be body. And once it starts to get narrow again, we're going to call it the pyloric portion. So this is going to be your pyloric portion here. So just remember, cardiac portion, fundus, body, pyloric region is going to be over here. And then this one, same thing. Cardiac region, fundus, body, pyloric region's over here. After that, we have a pyloric sphincter. So you can see here where it starts to get really narrow. This is a muscle ring that can actually close off so that the food doesn't just fly through your stomach into your small intestine. So this is going to be your pyloric sphincter right here. Shown on this one, pyloric sphincter, I think they're labeling 409 on this one. And then this one you can see where it pinches, pyloric sphincter right here. All right, other than that, inside of your stomach you have all these lovely folds. The folds are called rugae, so all these little rugae are the folds. This one again, rugae for folds. And that's it for the stomach. Basically right here, and then I'm going to show it on the other two versions of the intestines we have.
Go ahead.
All right, ready? So now we're going to do the small intestine. So the first thing I'm going to do is actually going to take off a chunk of the large intestine so you can see the small intestine. So I'm pulling off large intestine. So you can see here, the stomach comes down, we go through the pyloric sphincter here. Now we've entered the small intestine. The first part of the small intestine is called the duodenum. It's basically the first 10 inches of the small intestine. So this whole little region here coming up and around is going to be your duodenum. If you see here, this is the pancreas, this kind of blobby shaped thing with the big long stripe in the middle of it. There's a little nub right in the center where basically the pancreas and also the liver dump their fluids that they make into the small intestine. That little nub is called the duodenal papillae, or the papilla, so duodenal papilla here. After you go through the first 10 inches of the lovely small intestine, you move into the second section of the small intestine, which you probably label near the number. This is going to be your jejunum, so it's the next chunk of the small intestine. And then the very last chunk here, you can see at the very end, it kind of wraps around and it comes up and it has a little pinched off region. This is going to be your ileum. And at the very, very end, you can see this little squished up region. It's a muscle ring, shockingly enough, it's a sphincter. It's going to be your ileocecal valve. So ileocecal valve, because it goes from the ileum to the cecum, which is the first part of the large intestine. So just remember, the ileum is the last part of the small, the cecum is the first part of the large, ileocecal valve is going to be here. That's it. Okay, now I want to show you on these ones too. Okay. So same story, but just a little bit, it looks a little bit different depending on which section of intestines you're looking at. So this is from one of the torsos, and then this one up here is actually from a second torso in the back of the room. So I just want to show you on both of these as well. So if you look here, this is going to be in the gray is your large intestine. So I'm actually going to pull the small intestines out of the large intestines. And you can see here where the small intestines first start. This would be your duodenum coming up around 432, I guess. And then the next section would be the jejunum here, and then the last section over here would be your ileum. And if you look at the back, you can see where the ileum ends. This would be the ileocecal valve at the very, very end. You can also see it over here where it feeds into the cecum, the first part of the large intestine, the ileocecal valve. So that's the intestines from one of the torsos, and then this again is just from the other torso. So in the brown is the large intestine, this is the small intestine. If we pull them apart, again you can see where the duodenum starts. So this first chunk's going to be the duodenum, basically. You can't really see the papillae like you can see the other one though. So the duodenum is here. Usually they'll throw maybe it's towards the center where it's 48. This would be your jejunum here, and then at the very, very end you can see the end of the tube. If you follow it back, this would be the ileum down here. So at the very end would be your ileocecal valve. Again, you can see the ileum's coming around. It's joining up with the cecum. This would be your ileocecal valve here in this torso or particular model. That's it for small intestine. So now we're going to go to the pathology. All right, here we go. So this is actually, believe it or not, this is not upside down ice cream cones. It's not, what else do we think it was, a tongue? This is actually the wall of the small intestine. So if we look zoomed in on the wall of the small intestine, this is what we would see. So if we look, the first layer of cells are going to be your epithelial cells. So these little kind of square-shaped cells that line these little villi are going to be epithelial cells. In the center, you have a little yellow tube called the lacteal that picks up fats that you're absorbing from your food. The next layer down, this little red layer here, is going to be your muscularis mucosa. So this is your muscularis mucosa layer here. The next layer, that's kind of peachy color, is going to be your submucosa right here. And then the thicker layer of muscles is going to be your muscularis externa muscles down here. So it's going to be this nice big layer down here. Inside, if you actually look at this little epithelial tissue and you zoom in, this is supposed to be a magnifying glass, not a big circle. So if we zoom in on this little cell, this is what it would look like. This is basically this crypt. You can see these little yellow, or not yellow, little white dots. These are called goblet cells. They're going to make a bunch of mucus. Inside here, we also have these little red dots. These are called Paneth cells. So Paneth cells are going to be these little red dots. If we look on the outside of that now, going back out to the layers, Orbox plexus is going to be these little light blue, white colored dots out here. This is Orbox plexus here. And then Messner's plexus is going to be the ones that are in the submucosal layer up here, so a little bit higher. So just remember, Orbox are in the muscularis externa layer, whereas the Messner's is going to be in the submucosal layer. And that's it for this guy. You tell me. Okay. Alright guys, so we're going to do the dissection of the cat for the first exam. So it's going to be basically the heart and the major blood vessels that come off the heart. So I've already opened up the chest clearly, and I wanted to show you guys the pericardial sac. It's just this kind of plastic bag that's wrapped around the heart. You can see it, it looks kind of like plastic. You have to get the pericardial sac off before you can see the heart, but this is what the pericardial sac looks like. It's got some fat on it, but this actual plasticky looking thing is the actual sac itself. So I'm going to pinch through this, pop a hole, get the fat off. This is the pericardial sac. But I gotta get it off or you won't be able to see your atria and your ventricles. There's probably gonna be some coagulated blood and everything else in there, but that's okay, we got some blood. Let's put my finger in there. Okay, so now we can get the heart out. So this is a heart. Clearly a lot smaller than the sheep hearts we worked with earlier. I'm just gonna kind of cut the pericardial sac back so we can see it as much as we possibly can. So it's very, very tiny, but that's okay. So obviously this is going to be the right side of the cat. Remember, it's always, or sorry, the left side. It's always in relation to the cat, not to you, or to the specimen, not to you. So this is going to be the left side of the heart here. This is going to be the right side of the heart here. You can see here, this little kind of flappy looking thing is going to be your right atrium, which means that this is going to be your right ventricle. This will be your left ventricle, and then this little guy over here would be your left atrium. So those are the major parts of the lovely heart. So if this is going to be my right ventricle, if we follow it up, there's a tube right here between the two atria, this tube that I'm squeezing. This would be the pulmonary trunk. So the pulmonary trunk, remember, goes off at an angle, just like it does in people and in sheep, it goes off at an angle. So your pulmonary trunk is right there, which means that if we just get a little bit of this fat out of the way, fat heart, this more red-shaped tube here that kind of wraps around the back is going to be your aorta. So pulmonary trunk is in the front, aorta is kind of behind it a little bit. Okay, our parts of the heart, so we already talked about the ventricles and the atria, but remember this pointy part of the heart is going to be your apex of your heart, and where all the blood vessels come in and out will be the base of the heart. On the heart you can see the little red coronary arteries, so those are going to be your little coronary arteries feeding the heart itself, because remember the heart is a muscle. Moving off of that, so we're going to start moving up. Coming off of your heart, obviously you have the aorta, but then you have a brachiocephalic artery, which is this big one right here. So the brachiocephalic artery is here, there's only one. And then it splits into the right common carotid artery and the left common carotid artery. So those are only arteries that I think you guys need to know. Oh, no, I lied to you. Then coming up over here, you actually have your left subclavian. So unlike in people where the aorta has 3 branches coming off of it, the cat only has 2. So the cat has the brachiocephalic with the common carotids coming off of it, and if you actually lift this vein out of the way, you can see there's actually another branch. You can just barely see it where it splits. See the split right there, hopefully? Where it splits into 2.
Sure.
Maybe? I want to make sure you see it. But it splits.
You can
see it. Okay, so the split, this one is going to be your right common carotid, but the other branch, the one that goes this way, and it comes off over here, is going to be your right subclavian. So it was right subclavian, right common carotid, left common carotid, all coming off of your brachiocephalic artery. And then the guy that's by himself is going to be your left subclavian. He comes over and he feeds into the arm, eventually becomes an axillary and everything else. So those are all of your lovely arteries. Now veins are going to be in blue. Remember, only time that you see red veins are going to be in the pulmonary veins, but everywhere else in the body, the veins are going to be blue, the arteries will be red. So off the heart, you have 2 major veins. So you have the superior vena cava, this big huge tube that's above the heart, and then if we lift the heart up and look underneath it, you have a big blue one down here that's going to be the inferior vena cava that goes down the rest of the body. So coming off the superior vena cava, it branches into a left and right brachiocephalic vein. So this would be your left brachiocephalic vein, this would be your right brachiocephalic vein. And then I think that is all you, oh wait, and then the other veins you need to know, I don't think you need to know subclavian veins, you don't. Well, the subclavian veins would just be this blue one over here. This would be your left subclavian vein, this would be your right subclavian vein. And the other branch, this one obviously is broken, it should be connected right here, shouldn't be broken. And then the other one is over here, this one that comes up is going to be a jugular vein. So this would be your left jugular, and this one here that's snapped would be your right jugular. And that is it for this guy.
Good to go.
Alright, so this hard structure up here, basically from right here up, you actually poke on it, it's hard cartilage, so this is going to be your larynx. So from here, basically from this point here to this point here is the larynx. This top larger piece of cartilage is going to be the thyroid cartilage, and then this smaller chunk of cartilage right here that I'm pinching is going to be your cricoid cartilage. So cricoid cartilage, thyroid cartilage, just like in people. That's going to be a larynx. This is the trachea here. You can tell it's trachea if you run your thing along it, you can actually feel it kind of like a flexi straw, like when you do like the bendy on the flexi straw, it's got like the little ridges, so you know that this is trachea, and it's also got the little tracheal cartilage ring, so you can see it. Behind it, posterior to it, is this deflated tube, which is going to be the esophagus. It looks very, very different from a trachea. So this is an esophagus, this is a trachea. If we move down the trachea towards the bottom, I'm going to get the blood vessels, the major ones are coming into the heart out of the way. We follow the trachea all the way down. And the very last chunk of trachea, I've cleaned it up as best as I could, but you can see that there's a branch that goes this way and there's a branch that goes this way. This last little section of the trachea would be the carina. Remember, it's that weird shape, kind of diaper shaped piece of cartilage that kind of wraps around in like a little triangle. So carina would be here. This would be your left primary bronchus, and this would be your right primary bronchus, and they feed into the lungs. So on your lung, you're going to have the apex of the lungs, which will be up here. So if we pinch them, these little top pointy parts of the lungs are going to be the apex, whereas the lower flatter part down here that lines the diaphragm, this is going to be the base. So the base of the lungs are down here, the apex is up towards the top. This region of the lung here where everything is coming in and out, where you have your bronchus coming in and out, where you have your blood vessels coming in and out, would be the hilus. So the hilus is here. And then remember, for lobes, the left side only has 2 lobes and the right side has 3. So if we actually look carefully in here, this, even though it looks like it's 2 lobes, it actually is connected in the back. See how it's just one actual lobe in the back? So even though it's got a split in the front, it still only counts as 1 lobe. So this entire thing would be the superior left lobe. So superior left lobe, and this guy would be your inferior left lobe. Because remember, the left side only has 2. On the right side, you have one piece here, goes all the way back, completely separate from everyone else. This would be your superior right lobe, the middle right lobe, and then the last one down here would be the inferior right lobe. And that's it for respiratory system.
Yep.
Alright, so now we're going to do the digestive system part 1 for the second exam. Obviously all this blue crap is not supposed to be there. It's just a vein exploded, a big one, and it just kind of put dye everywhere. Note to self. Alright, so we're going to start at the beginning. So just to get the trachea out of the way, this again is the esophagus. We can actually follow the esophagus down, 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 down. And if we look under here, this is our esophagus here. So it's still esophagus here. And you can see, this is the diaphragm, this sheet of muscle. There's a hole in the diaphragm where the esophagus is going through and coming out the other side, which we might be able to see, hopefully. Yep. So this is our esophagus coming out. This is the stomach. So the esophagus is here coming out the other side of the lovely diaphragm. So this hole, pop a hole in this thing and get it, there we go. So So this hole that the esophagus is coming through is the esophageal hiatus. So esophageal hiatus, esophagus. Here we are at the stomach. So as we're moving into the stomach, there's a whole bunch of parts you need to know on our lovely stomach. The first part of the stomach where it attaches to the esophagus, so this little region right here of the stomach, is going to be your cardiac portion of your stomach. This upper dome shape is going to be the fundus. The majority of the stomach is going to be the body. When it gets narrow over here, it's the pyloric portion or pyloric portion you have down here. Where it gets really narrow and tightens up right here, you can see where it looks like there's like a piece of invisible string kind of wrapped around. That's going to be your pyloric sphincter. And if we actually open it up and look from the inside, you can see right there's a little hole. Pyloric sphincter, okay. We have the greater curvature of the stomach. So the greater curvature is this outer curvature, and it has all this fun, well, it's not supposed to be blue, it's supposed to be yellow, fatty material. This is called your greater omentum that I'm squeezing. All this is greater omentum coming off the greater curvature of the stomach. You have a lesser omentum, again, this blue, which is not supposed to be blue, it's supposed to be yellow on the inside, in the lesser curvature of the stomach. Moving along past the stomach, so the first section of the small intestine, so it's going to be this section here, is going to be your duodenum. If you just kind of go a little bit further along in the intestines, go towards maybe like the middle, we're just going to call this middle part jejunum, and then when we get to the end, because this is obviously a larger tube, we get to the end, this last little region of small intestine is going to be the ileum. So this is ileum. You can see it's not the same thing as a large intestine because it's a lot smaller in diameter. See the size difference? Large intestine, last little section of small intestine. So this is ileum. And at the very, very end, where the ileum butts up to the first part of the large intestine, you have the ileocecal valve. Again, you can see where it gets really, really tight right in here, ileocecal valve. And if I open it up and look at the inside of it, again, you can see a little muscle ring right here. It's got some crap in it, but that's okay. That's going to be your ileocecal valve right there. So ileocecal valve is between the ileum and the first part of the large intestine, the cecum. That's it. Okay.
Yeah, go ahead.
All right, guys, so this is going to be for the exam number 3, Digestive System Part 2. Exam number 3, Digestive System Part 2, in case we edit that out. So again, this cat is not supposed to be exploded blue just because a blood vessel blew up somewhere, a vein blew up. So we're going to start with our Digestive System Part 2 for the cat. So we're going to start with the pancreas. So what we need to do is actually find the stomach first and then look underneath the stomach. This pink blobby looking stuff is actually going to be your pancreas. So you can see the pancreas here, wrapping around underneath the lovely stomach. You also have a liver, so your liver is this large brown structure here. So we have a large brown liver here. You have a hepatic portal vein. For some reason in this cat, the veins are not blue. I think probably because all the blue dye is everywhere. So what we have left is actually a yellow tube. So your hepatic portal vein is going to be this yellow tube, this large one here, actually coming from the digestive organs and feeding into the liver. So it's this big yellow one here. It probably is going to be blue in most of your cats. Also, hiding underneath the liver, you have a little bag. This little bag right here is called the gallbladder. So your gallbladder is here. If we move down now, so this is all small intestine, but if we look at the size difference, remember the large intestine, if I put my thumb on it, is wider than my thumb. Small intestine skinnier than my thumb. So this is going to be large intestine here. It starts where the small intestine ends. Remember there's the ileocecal valve right here. We actually found that ileocecal valve from the inside. It looks like that right there. So this first part of the large intestine is going to be your cecum. So cecum is here. This is all going to be large intestine or colon, and then once you get to the last region before it leaves the body, basically as poop, you're going to be inside of the rectum. So the rectum is the very last section of the large intestine. We'll actually pass the large intestine, but it's the very last section right here of the tubing. Now we need to find some arteries. It's a miracle I didn't manage to break any of them, so here we go. This large red artery right here is going to be your superior mesenteric artery. Mesenteric means it basically feeds the mesenteries, so mesenteric artery here. Your inferior mesenteric artery is going to be right here. So superior is more towards the head, inferior is more towards the tail. This very large tube that runs right along basically the back of the cat, it starts all the way down here in the pelvis, way down here in the pelvis, and it goes all the way up to the heart. It's going to be your aorta, so it's going to be your aorta right here. And next door, the big blue one's going to be the inferior vena cava. Again, it goes all the way to the heart, so inferior vena cava is going to be here. And then the very last artery you guys need to find is the gonadal arteries, and they're little tiny ones, but you can see there's one that runs this way, and there's also one over here that runs this way. So they're above the superior mesenteric, but below, they're above the inferior mesenteric, but below the superior mesenteric in the middle. And there's 2 of them, and they run down to the testes or ovaries, depending if you have a male or female cat. That's it.
See.
All right, cat urinary system, here we go. So this is obviously, we got all the guts out of the way. This is a kidney. Coming up the kidney, you see there's a blue tube right here. That would be the renal vein. And then kind of hiding in the back, you have a red tube, which is going to be your renal artery. Coming off of here, there's a tube that doesn't have a color. This is going to be a ureter, and then obviously the urine's made in the kidneys. It travels down the ureter, then it goes to this little bag right here. This would be your urinary bladder. And then coming off the bladder, when you actually go pee, this last little tube is going to be the urethra. So urethra, urinary bladder, ureter, kidney, renal arteries, the red one, renal veins, the blue one. That's all she wrote. We're ready now. And then randomly the spleen too. So, okay, so we're just going to throw that in there too. All right, guys, so this is going to be for exam number 2, the lymphatics, blood vessels, and nerves. So randomly the spleen, so this is the stomach, this is the greater omentum, and this tongue-looking thing is going to be your spleen. It could be bigger or smaller, it could be different colors, but just know it's kind of attached to the omentum, usually the greater omentum. Now we're going to go to blood vessels, because that makes sense. We're going to go up here, and what we're going to follow is basically, remember, you're coming off the aorta, you had your, if we're coming off this side, we're coming off the left subclavian. So the subclavian, once you get to the armpit of the cat, what we care about is going to be the axillary artery. So in the armpit, it's called the axillary artery. Once we get to where the bicep is, it's called the brachial artery. And then we're going to move down into the actual forearm. So you can kind of see there's a little bit of an artery down in here, this little red guy. It's on the thumb side, so it's going to be the radial artery. Whereas if we look on this side, the little exploded one, where did he go? In there. The little exploded one is going to be your ulnar. It's on the pinky side. So they're blown up. I don't know what else to tell you guys. I looked for them, couldn't find them, so they're just kind of exploded. So if it's on pinky side, ulnar, thumb side, radial, brachial, axillary. All right, now we're going to move to the lower part. We're going to skip all this. Coming off your abdominal aorta, so your aorta is the big red one. When it splits, you can see here, it splits into this one. There's a tube here and there's a tube here. These are going to be your external iliac artery. So this is going to be your left external iliac artery. And over here, you're going to have a right external iliac artery. Your external iliac is going to turn into your femoral. So basically, once you get into the leg, this red tube now is going to be called the femoral arteries. It moves along. And then the popliteal, I don't know where it is exactly. I'm assuming they're just going to kind of pick one that's near the knee. But again, most of the arteries are already blown up by the time you get this far out. There is a little one right here, a little tiny red one that I guess you might be able to call popliteal, or maybe someone they're going to find in the back. Just remember, popliteal means back of the knee. So if you find one back there, that's your popliteal artery. Now as far as veins go, back up towards the heart. Remember you had your superior vena cava, then you had your left and your right brachiocephalic veins, and then the only other vein you apparently need to know is way down here. Coming off of your inferior vena cava, the big blue one. If we get the red one out of the way, we can see underneath there that he splits into a left and a right. The left one would be the left common iliac vein, and the right one would be the right common iliac vein. That's it for iliac veins and arteries. Now nerves. So we're going to go back up to the arm. You can see here that there's a nerve that's in the middle of the arm. It's called the median nerve. In some cats, it might be a little bit smaller than this, but it's right down the middle of the arm between basically where the bicep is and the tricep. So this is going to be your median nerve here. Musculocutaneous are going to be a bunch of little nerves that kind of look like a little spider web. Like here's one right here that feed the skin and the muscles. So musculocutaneous, there could be a whole bunch of little ones that go up into the shoulder. Ulnar nerves and radial nerves, so you're going to look right where you'd expect them to, look on the bone. So here you have your ulnar nerve because it's on the pinky side. And if you look over here, you have your radial nerve because it's on the radial side. And that might be your radial, there's your little radial artery right there hiding underneath it. Alright, and then the other ones you need to know are going to be in the lower leg. So in the back, if we get the biceps femoris out of the way, this is actually just a little bit of fat coming off of this side. Here we go. This big fat one is called the sciatic nerve, and it actually splits into two different nerves. The one that goes to the outer part of your leg where your fibula is going to be the fibular nerve. You can also call it the perineal nerve or common perineal. So common perineal or common fibular nerve is the smaller one. And this one back here that's bigger and fatter is going to go to the tibia. It's going to be the tibial nerve. That's it.